I knew that I wanted to focus on child and adolescent mental health. Most of the interventions that have been published were really very much about how to support children during natural disasters, support children who were, child soldiers. But there was nothing about mental health promotion or prevention and thinking about how do you create a foundation for lifelong, good, positive mental health. I wanted to take a step back and kind of actually understand from a cultural standpoint, like what were the responsibilities of parents and children, ethos around parenting, and did they align with kind of the moral values and the decision making that was inherent in these interventions that were developed in another context? We all know what has happened in 2025 in terms of funding and the cuts. And unsurprisingly, mental health is one of the first things that gets cut, particularly mental health promotion and prevention. We're a bit stuck at the moment. We see this as a really important opportunity. We don't want to lose momentum.
Welcome to Mind the Gap, a podcast about what's missing in global mental health.
I'm Christy Savetta.
I'm Chris Underhill.
And we're here to explore the stories, solutions, and systems shaping mental health around the world.
From community champions to global change makers.
Let's dive into what's working and what's not.
And what it'll take to close the gap.
Hello, everybody, and welcome back to an episode of Mind the Gap. We are so excited to have Dr. Tatiana Salisbury here with us, who is going to talk to us a little bit about her background, her experience, her life, what she does, and we cannot wait to dive in. Tatiana, we are so pleased to have you with us. For folks who are new to you, new to your work, can you tell us a little bit about yourself?
Yeah, sure. Thanks for having me. So I'm a reader in global mental health at King's College London in the UK, where I'm also acting as the director of our WHO, so World Health Organization Collaborating Center on Research and Training in Mental Health, and as the co-director of our Center for Global Mental Health, which is a collaboration between King's and the London School of Hygiene and Tropical Medicine. So a lot of things on my plate at the moment.
Oh, that's quite a number of things and very impressive things as well. I'd love to dive into those. But for folks who are kind of new to this space, getting into mental health and global mental health in generally is kind of a niche thing for a lot of folks. So could you tell us a little bit about some of the early experiences or maybe ideas that first shaped your interest in mental health? Were you always interested in diving into mental health?
No. So I think, as a child, you have all sorts of things that you're really interested in. Growing up in Southern California and spending a lot of time at the sea, was really interested in aquatic creatures, particularly dolphins. I think there's a lot of girls out there that really love dolphins at a young age. And this fascination with orcas, particularly because I grew up in the time of Shamu at SeaWorld. So going there and seeing that, what I really wanted to do when I was probably 8 years old was to be a trainer for the orcas and work with Shamu and swim with Shamu and basically just be able to hug Shamu whenever I wanted. I don't know where that came from exactly. It wasn't logical because I'm not the strongest of swimmers. And really, I'm not that great with animals. That's what I wanted to do. And it wasn't until, I don't know kind of where the shift happened, but then there became the shift more towards medicine. And being a doctor. Probably, I imagine, because I had a really lovely pediatrician. And then I thought, oh, what a nice job. I'd like to do something like this. So I think for my teenage years, that's what I was working to throughout high school. Then, when I made it to university and started as a pre-med student, I was studying human biology. I think from there, that's where I became introduced to mental health and the challenges within that. So I took a course on boys' psychosocial development, and really that was what pulled me into this area because I found it so interesting, and was peppering my professor with questions who said, well, actually, this isn't a very researched area, so maybe you might want to do that. And I think kind of looking back at it, I think I've always been interested in people. And how our kind of personalities and our own characteristics and the environment shape how we, who we are and how we react to the world. And then on the other end, I just find mental health so complex and challenging that there's always something new. So it constantly causes you to think and problem solve and question. And so I found it to be a field that is never boring and endlessly fun and meaningful.
That's absolutely, I couldn't agree with you more. And also, as a young girl who also had dolphin stickers all over her notebooks, I completely, I completely empathize with that experience.
Yeah, the
Um,
trapper keeper.
yes, exactly, exactly. That's so interesting. So your first introduction really was this project around studying boys' ideas of masculinity, right? So what drew you into that particular field or that particular project in general? Was it just the opportunity? Was there something specific about it that made you think, oh, this is interesting. Let's dive in.
Yeah. So I think, I mean, the topic interested me because I have one brother who is 11 years younger. So I say we're both only children. And at the time, he was probably around then, I guess, 7 or 8. And I, being far away, I probably was quite interested to understand what life was like for him. And growing up as a girl, in California or kind of anywhere, particularly in the US, we were always kind of bombarded with how difficult it was to be a girl and how difficult it was to be socialized in America at that time, and the challenges that came with it. But I had never really thought about that actually it wasn't easy for boys either. And that really for boys, that socialization happens much earlier than it does for girls. So for girls, it's usually, it's okay for you to be a tomboy until you hit puberty, and then questions start being raised. But for boys, if you're a 4-year-old and you're playing with a doll, or you're doing things, then it does make people uncomfortable. And there are things that are said, and there's not as much flexibility for boys to kind of explore the various sides of themselves and feelings and experiences. And so I found that to be just completely fascinating because it was something I'd never considered before. And we had a session, I think, about eating disorders, which I always just, pretty much put that into the bucket of problems that girls, women have. And so that really opened my eyes to see, like, actually, there are lots of other things around this and the complexity of it. And that's then what I focused on in doing kind of my research. So that's, pretty much how I got into it, is just, finding something interesting and just starting to ask questions and trying to work my way around it to understand the situation.
Yeah. Yeah. And did that, in terms of the projects that you carried on with, I suppose, prior to diving into the global part of mental health? So when you were at UCL, University College London, as well as Oxford, what kind of projects did you take on there? And what was your career like around that time? Can you walk us through that journey after that initial toe dip
Yeah.
into mental health?
Yeah. So, I mean, that project kind of led me to really find my calling in research. And for me to say, actually, I don't want to spend all of my time going to medical school, and I just want to work on research, which was not a popular thing in my household for the first week or two that I put that idea out there. But afterward, my family, really became supportive of this, and I moved then to Oxford to do a research methodology course, learning how to do systematic reviews. It was a lark. It wasn't that I was interested in systematic reviews. It was just that was a course that was open. I wanted to go and move to another country. And so, just strategically, it worked out. It wasn't a passion per se for systematic reviews, but I thought that was a good place to start. And then from there, I think what I just did was I found what were the bits and pieces that I actually enjoyed about my work and the things that I was doing. And then how could I take that along to whatever I was doing next? So I used the skills that I had gained from that master's to get my first research job, which was actually conducting a systematic review for the Cochrane reviews. And so there was that quantitative aspect, and this was in self-harm and suicide, but there was also a qualitative component as well. So I also was conducting a narrative review about people's experiences of turning up to emergency departments after a self-harm episode. And I think that's what really struck me, were those qualitative interviews and those reports about how people were treated, what they felt like, and also then what impact that had on their help seeking in future. And their kind of the trajectory of the challenges that they were having. And so from there, that made me realize that actually, maybe it's not systematic reviews that I enjoy doing that much. And I have to say that, I still work on a lot of them, but I'm glad that I'm not in the nitty gritty of having to do them. I find them very tedious and challenging. But then kind of moving into the importance of service provision and delivery and what quality of care looks like. So that helped me to look at and look for new jobs, which is how I ended up at UCL, which was really focusing on how do we develop a toolkit to assess quality of care in longer term rehab facilities. So moving on to kind of a different area of mental health, primarily people with a diagnosis of psychosis or very severe bipolar disorder. And through that, it brought me into services. It brought me into interacting with people, which was also something that I missed or I wanted to have as part of my role, because I didn't want to just have a theoretical exercise being my line of work. I wanted to be actually working with people, interacting with them, and feeling like I was making some sort of difference that I could see. So in doing that, I found, again, that was really interesting. I was able to help to lead a project, a multi-country project. So this was all across Europe. I was able to travel to different European countries and see what their services were like, and again, meet more people and learn. And from that process, I kind of came out of it thinking, there are a lot of things that people are doing in different countries that are actually really useful that aren't being done in the UK. And so why is that? Why do we have such a disconnect? Why do we work in silos? Why aren't we collaborating in order to improve, outcomes for everyone? And that got me into kind of international mental health, and these weird terminologies, that kind of spring forth from there. So when this idea of global mental health and a job in global mental health came up, I thought, oh, that's what I'm doing, not knowing that that wasn't exactly what I was doing. But I thought that's what I'm doing, and let's go ahead and try for that job. So kind of I stumbled into global mental health, not knowing that it was, in the end, an area that I was really interested in and passionate about. So I always kind of say that things always work out for the best, and they never work out as you've planned. And it definitely wasn't my plan. So if you asked me when I was 18 or even 22 and graduating from university, where would you be? I didn't even know global mental health existed. So I definitely wouldn't have said that this is where I would have been. But it's been a wonderful journey, just kind of moving in that direction of what are the things that I'm good at? What are the things that I like? And using that to guide my next steps.
Right. And actually, if you look across your full career journey, that is what you've done, even from the beginning, right? When you were 8 and 11, looking at aquatic life and saying, this is where I want to head, this is the interest. And then actually I really want to focus on people. So you kind of shifted that direction. So you can see that thread throughout your work. And it really brought you into this sector. And I want to dive a lot more into that, actually. And I think this feels like a moment where we're going to talk a bit more about your work being increasingly international and likely systems focused, especially with kind of the services lens. So Chris, I'll hand it over to you. Do you want to jump in and bring us into that journey?
Sure. What a fascinating conversation so far. Hi, Tatiana.
Hello.
Yes, absolutely. Thank you, Christy. I was thinking, and by the way, I jumped into global mental health through the whole process of community development. So, I came to it in just a sort of haphazard way, as it were. Not that I'm insulting you, Tatiana, but
not at all. That's a good description.
But it was sort of haphazard for me as well. So there we are. And it's made me think, listening to you, about the whole question of how an intervention is designed by researchers, and the degree to which it then becomes a useful idea or a useful proposition for people. So when did this whole question begin to be an important realization for you? When did you really start to think about project design on the one hand, and how it would be helpful and useful for people on the other?
Yeah. So I think it's something that I've always been interested in, but it probably didn't know that there was a field or an area of study or approach that actually encompassed a lot of the things that I had been thinking and that felt aligned with the way that I wanted to work and kind of my values and all of that in one. So when I first started in my role as a lecturer, so kind of the first rung of the ladder of academia within global mental health, I was very lucky because I wasn't put onto a project. I was just kind of hired within the center. And actually, I worked across both King's and the London School of Hygiene and Tropical Medicine. And so was introduced to a wide variety of people and a wide variety of thoughts. And in that, as I started to try to figure out what was it that I wanted to do, because I had, I had the luxury of that time and that freedom to do that. It was really, I knew that I wanted to focus on child and adolescent mental health. And then if I then thought strategically, I started thinking, well, if I'm thinking about this in the context of a lower middle income country, what is going on there? Most of the interventions at that time, so this is around kind of 2012, 2013, most of the interventions that have been published were really very much about how to support children during natural disasters, how to support children who were, child soldiers. But there was nothing about mental health promotion or prevention and thinking about how do you create a foundation for lifelong kind of good, positive mental health. And that was what I was very much into. I think partially because I wasn't a clinician, that just kind of also felt like a really nice spot for me to kind of work in. But also, I just feel like why, you shouldn't always be fighting fires. You should actually be trying to prevent the fires. And so, through that, then I started thinking about parenting interventions and what were things that you could do, that parents could do to actually support children. And there was a lot of that happening, with interventions developed in North America or in Europe or in Australia. And so I was interested in how those might translate into another country. And particularly, I'd found some colleagues in Indonesia who were quite interested in this, and we thought we would do that. But I wanted to, instead of kind of what the prevailing ethos of the day was, you just take the intervention from a high income country and just put it into and test in this new context. I wanted to take a step back and kind of actually understand from a cultural standpoint, like what were the responsibilities of parents and children? What were the ethos around parenting? And did they align with kind of the moral values and the decision making that was inherent in these interventions that were developed in another context? So, put in for an application for funding for that work, and it was, immediately rejected. And the peer review comments were just kind of exactly, why would you do this? You just take the intervention and drop it in and do that, which really was uncomfortable for me. It didn't sit well. And so I just kind of left it and said, okay, how am I going to keep doing this? And it wasn't until I'd taken 2 years off kind of in quick succession after having 2 children that I came back into my job and said, okay, what is it that I want to do? And I used that time to just kind of take a kind of a wide view of what has happened in global mental health over the last decade and where we were kind of now and what gaps we had. And what I saw was that we had focused on the treatment gap. And that was all very much about supply. So we had tons of interventions, lots of research showing that they were effective. But then now I'm sitting here kind of a decade later going, well, where are these interventions? They're stuck in journals is where they are. They're not actually helping anybody. And then that got me thinking then, okay, well, why is that? Why is this happening? And a big reason for me as to why that was happening was because of the way in which interventions were traditionally developed, which is, they're developed from existing evidence and guidelines and experts, but those experts are clinicians, they're researchers like me. They're not necessarily the people who need to fund that intervention, who need to deliver it, and definitely not the people who are going to be receiving it. And so that kind of brought me into this thing about, well, how do we get all of these people engaged to understand their perspectives, to figure out what solutions might actually be successful and easy to embed within an existing context.
Mm.
And so it wasn't until I was talking to one of, my best friend who is an app designer. And I asked her, I said, this is what I've been thinking about. And she said, oh, well, that's what I do. And I said, oh, excuse me, this is very different. And she's like, yeah, okay, so this is what I do in my job of, in tech. And there are people who are doing the things that you say that you want to do, and let me connect you to some friends of mine. So through that, I got connected to a lot of human-centered designers and then I started reading quite a lot about the work, particularly at Stanford, because that's where I did my undergrad, talking to people at IDEO, and then just kind of designers all over the world, really. And that helped me to find, an evidence base,
Mm.
and also to know that what I was thinking was not completely off the wall. Everybody always thinks, oh, this is a new thing, but actually it wasn't new. This is just, a long line and a succession of thought. But I think having that vocabulary and having that evidence base behind me was really useful in getting the first grant to show a proof of concept within mental health about this could work. I mean, obviously, this has been done, in international development for many years prior, but bringing that into mental health was kind of, at the time, fairly new.
Yeah, that's fascinating. And what an interesting journey of both a professional and career journey, but also a journey of thinking and rethinking, I think, and thinking, rethinking, and borrowing and refashioning, which I think is exciting. I was interested to hear about the collaborations with Stanford, King's College, and so on, and the whole question of design thinking. And then that has led you, I think, at some point in your career, to a Gates-funded role in a major perinatal health project, which itself faced some hurdles, didn't it, in terms of approval and so on. Do you want to just touch on that? And then what I think we should do next is then talk about thriving mamas and community impact. That would be good to do.
Yeah, fantastic. Yeah, so when I got back and was having all of these ideas, it just, things happen, at the right time and for the right reasons. And so I was having this discussion with my line manager about, these are the things I'm interested in and what I might like to do. And I'd noticed that there was this Gates Foundation call specifically about the mental health of young mothers. And he told me, he said, well, while you were away, there's a new group of researchers that have just joined King's, and they've got this large cohort study in perinatal health. And so it might be they're interested in mental health and incorporating that into this study. So why don't you talk to them? And in a matter of 5 minutes, I think we just clicked. They said, yes, this would be fantastic. And we'd love to kind of host this under the umbrella of our study. And let's introduce you to our colleagues, in Mozambique, who might be able to kind of support on this project and partner with you on it. And so that very quickly kind of took shape. I found partners at the Helen Hamlin Center for Design at the Royal College of Art here in London to really provide that basis for human-centered design and that approach. And we were really successful. And I think we were successful just because at the Gates Foundation, human-centered design was not new to them. Whereas for, government funding agencies, that was a very new idea and it seemed very risky. And, although they say they want risky things, they are still very much risk averse with their money. And so we were able to get that funding, and that pretty much just started the whole ball rolling because, I think what we found was that there's just a thirst in communities and an interest to be involved in this in a way that they had never been before, because they have usually just had people coming in saying, this is what we're going to do, doing it, and then leaving. And then people say, okay, they did it and they're gone and now they're gone and that's it. We just kind of carry on with our lives. Whereas this ended up being, with that project and my UKRI Future Leaders Fellowship, an 8 to 9 year long project that then also kind of encompassed and brought in our Kenyan colleagues into this. So it's been, a wonderful journey of learning for us, but also this wonderful journey of having communities engaged for such a long period of time and building their skills within our project, but also, to deal with other challenges within the communities without us, which I think is, a really nice legacy of the work that we've been doing as well.
This brings us then to Thriving Mamas, doesn't it? Which is
Yes.
The project which I it's not so much that I most associate with you, but it's one where we have had some interaction together. And so I just think, first of all, it'd be helpful if you could just walk us through what we mean by that and what it is that you do with it.
Yeah, sure. So Thriving Mamas is a co-designed intervention. So the way that what I mean by that is that we spent 2 years in the community talking to girls who were pregnant, talking to young women who had an experience of teenage pregnancy to understand what were their experiences of that, what were the challenges. We're not just asking about mental health, but we wanted to understand like what that journey was like for them and that transition. What were the challenges, but what were the things that really helped them as well? And then, talking to their partners where we could, talking to their family members, talking to community members and service providers about what they saw from their perspective as the experience of these girls. What were the challenges? What were the challenges for them as, on the other side of it of trying to support or having to deal, with what was going on, and what they felt their responsibilities were. I think, that's a really important thing, is understanding where that line is between what I think I need to do and what is somebody else's problem, and working with that. And so through that, we then developed this intervention through workshops. So the girls and all of these other stakeholders were part of determining, well, what were the priorities and what were the things we're going to focus on in the intervention? What was the content, and also the delivery strategy. So how did this actually embed into the existing community in a way that was helpful and feasible? And so what this resulted in is a 9-session, I call it an enhanced antenatal course. So the girls start during pregnancy. They have meetings every 2 weeks, which cover a variety of topics, such as just understanding what happens during pregnancy to your own body, how the baby is developing, what to expect at appointments so that they're not surprised or scared about what might happen to them, preparing for childbirth, that, for anyone is a kind of an area of a lot of tension and anxiety. And then bringing into it the kind of academic side and the research and evidence base around mental health in this time and what they need, what people need. So building skills to identify and manage stress, improving their ability to problem solve and to strengthen positive relationships, and also just trying to build a circle of support around these girls so that they feel like they're not alone and that they have people to kind of share the burden with and also to share the joys with. And then this whole issue around detecting mental health difficulties. So training the providers of this intervention to be able to screen for mental health, to be able to, in the sessions, be able to pick up and notice when a girl might be struggling, and then having a clear pathway for referral kind of back into existing services in the community or in the healthcare sector. So that's kind of generally what the intervention is about. It's called Thriving Mamas in English, but in Kenya and Mozambique, the girls named it, they provided their own names. So it has 3 names actually. And yeah, it's just been a really wonderful experience kind of doing that and partnering with these girls and with the community.
That's great. And I think now on the back of that, you're beginning to develop a toolkit to help young adults. Is that correct?
That's right. So kind of what we learned through this process, particularly from the service providers and government representatives, is that they really saw value in this way of collaborative partnership and equitable kind of exchange of ideas and development of interventions. But the challenge that they had was that they said, well, we don't really know how to do this with young people. And that, if you want to do something, but it seems too tricky, or it seems like it could be dangerous, you could have some sort of problem, then what happens there is that they just don't do it. So what we wanted to do was to develop a practical toolkit, because there are lots of guidelines about what you should be doing to engage people, but how you actually do it is a bit of a black box. So this toolkit tries to address that and bring that to the light, basically so that adults don't have an excuse to say, oh, we can't do this.
Well, I think that's very important indeed. Christy, we're getting to the point in the podcast, which is after all called Mind the Gap, and that's about the funding gap and what we've just been talking about, the skills gap and so on. I wondered whether, Christy, you wanted just to talk a little bit to Tatiana about the way in which the funding is taking place and so on.
Absolutely. And I guess, Tatiana, I mean, a little bit over to you. I'm curious, how has, I suppose, the funding journey and the funding landscape either influenced your work, and you could, in general, or influenced potentially where Thriving Mamas are, where the Thriving Mamas program is, and this toolkit, and kind of where are you on that journey, and how has funding really played a role in shaping what you do, what kind of projects you're taking on, and what potentially is coming next?
Yeah. Well, I mean, I think we've been especially lucky in funding over this kind of 9-year period. The Gates funding ran for about 18 months to 2 years. And then kind of quickly after that, I was able to kind of transition into my current fellowship from UK Research and Innovation. And that is the Future Leaders Fellowship is an amazing opportunity that provides 7 years of funding, up to 7 years of funding. And what that has allowed is for us to keep these communities engaged, rather than having breaks in between as we're kind of scrambling for the next set of funds. And I think it's allowed us to make kind of meaningful impact, not just for the project, but in the communities that we're working in. So we were able to develop the intervention and then run a pilot. So we ran a small pilot just to test, how is this working? Is it kind of giving us generally the outcomes that we're hoping to see, as evidence for applying for further funding for a larger trial? So at the end of that pilot, we found, yes, it was having good impact on reducing particularly moderate and severe symptoms of depression and anxiety. And also it was something that the girls and the providers and their families thought was fantastic. So we had, during the running of this pilot, we had families and people in the community bringing pregnant girls to us saying, oh, we've got another one here, put her in your program. And we had to say, oh, okay, well, we can't do that because we've closed recruitment and we're carrying on. But it was lovely to see that engagement and that desire to receive the intervention, which you don't always see within mental health. And so that kind of led us, and the goodwill from the community and kind of the desire to see this scaled up. We feel that we're in a really good position to kind of pull all of those things together and have a successful trial at a much larger scale across both countries. Now, that happened, we finished the pilot at the end of 2024. And I think we all know what has happened in 2025 in terms of funding and the cuts that are going on, not just in the US, but in the UK and across Europe, as priorities are shifting. And unsurprisingly, what has happened historically is that mental health is one of the first things that gets cut. And particularly mental health promotion and prevention, even within that is something that is just not on the plates of people. And, there's little desire to fund these sorts of things at that level. So we're a bit stuck at the moment now as we're trying to kind of transition and figure out where that funding will come from, because we see this as a really important opportunity. We don't want to lose momentum. And so it becomes this, challenge for us that is, I think, reflective and illustrative of the challenges that other people in the field are having at this moment. There are still some funding, opportunities available, but now they're being inundated with tens, and hundreds of applications for a few projects that will be funded. And so that puts us in a very precarious position. I have been lucky enough to kind of come across a philanthropic funder who has a small charity and has been able to see the value of what we're doing and has given us some money to look at partners and male heads of households and how we support them as a complementary intervention for thriving mamas, which is fantastic. And so I think kind of what we're trying to do is shift to say, okay, what bits of pieces of money are available and what can we do to continue to further our aims under kind of the scope and the kind of realities that we're living in the moment.
Right. Really trying to balance what's available, what funders' priorities are, and your program priorities, and looking at the two of them. Whereas beforehand, you might have been able to have your program priorities be a higher ranking priority in terms of what you're looking for. And it's a really difficult place to be in. We talk about it all the time with NGOs, nonprofits. You don't want to missions drift. You don't want to switch your aims, your research in any way, or your project. It's clearly working, right? It's clearly an interest. And I think that really speaks to this human-centered design and kind of design thinking approach, where actually what you built and what you studied is something that people wanted and what was helpful and what was useful. The community told you what they need, and you guys built it and you delivered it. And I think, I'm wishing you all best of luck with what comes next on the funding landscape. It's a difficult space out there. And hopefully, I think with this approach that you've taken and the outcomes that you've mentioned already, hopefully you'll find some good ways forward. I mean, I think that's bringing us a little bit to the close. Sometimes I find with our podcast, I wish we could solve the funding problem. We hear from everybody, and I have all of these ideas rolling on in my head, and I'd love to talk to you about it. But it's really been a joy and a pleasure, and just thinking a little bit about the threads that you've kind of woven for us today. I think this concept of designed thinking is really applicable both in the personal life, but also in your professional life, right? I think, Chris, you mentioned before kind of a haphazard way of like stumbling into global mental health, and I think that's actually quite true of many people in global mental health. I myself started as a crisis counselor and then jumped into tech for good, went into fundraising, and then found global mental health and did a course with Vikram Patel. And I was like, oh, wow, look at this world. But, I think it's a true thing when you think about careers as a playground rather than a ladder. You do kind of end up in new places, and you allow yourself to explore a little bit. And I think your story, Tatiana, is a real example of that in many ways, where you've followed your own interests, your own needs, your own skills, and you've also helped so many people along the way while doing that, while being true to what you want to do and what you want to see in the world, the change you're creating in the world, if you will. So it's been a real joy. My final question for you, just to kind of close out a little bit, what kind of advice would you have for your younger self, knowing where you are now? You said earlier you never think about ending up where you are. You're here and you're doing great stuff. What kind of advice might you have for your younger self or other people who might be thinking about, hey, I really like her work. She's doing great stuff. How do I get there?
Yeah. Well, one, get involved. So I think, the best thing to do is to just step right in, because until you're doing something, you don't know, one, if you're good at it, you don't know if you like it, you don't know if you hate it. So being able to do those things and put yourself in the situations that you think might be good for you is one way. And I think the other thing is just not to have a preconceived conception about what you need to be. And really, it is kind of focusing on that journey, focusing on the path. I know, you have to put in the strategic bits, and there are realities that people have to pay the bills and do these things. So really knowing that you might have to do that, but what are ways in which you can still begin to work towards that goal that you have? And if you decide partway through that actually that goal wasn't right, to feel confident enough to step back and try something else. You don't have to keep going down the same path. You can make a change at any point in time. It doesn't matter. Just as long as you are able to take in all of the information around you and make the best choices for you at that time.
Powerful.
Very
Absolutely.
powerful. Very
I feel
powerful.
like I should have had you on my shoulder as a teenager making choices. You know what I mean?
I don't think
it's
my
such
children.
fantastic advice.
I don't think my children would agree with that.
But you know what? That's a really I mean, it's a lovely answer, but I think you're a very good role model in that sense, Tatiana. And so the advice that you're given is obviously really useful for younger people, and that's really important, I think. But oddly enough, it's just as useful for me as you know, and I'm 77.
Exactly.
So it's actually good advice all around. You know, if you're not interested anymore, don't do it and do something else or try something else. You know, that's really important. Yeah. Tatiana, from my point of view as well, thank you so much for a wonderful session. We've really learned a lot, and we've enjoyed being with you, which is, you know, so important as well. So thank you so much for your support today and for giving us a very interesting insight to your work and life. Thank you.
Thank you both so much. It's been absolutely delightful.
Great. All the best.
Okay.